name's Jodie and I'm here at the QUT Clinical Practice Facility, and I'm going to show you how to put an IDC, an indwelling catheter, into a male and a female patient. This is a skill that you will be able to do out on clinical prac and will need to be confident and competent in while you're out there. So the equipment that you will need to do your IDC is your catheter pack, the relevant sized catheter for your patient, 2 vials of chlorhexidine solution or the relevant cleaning solution for your facility, lignocaine 2% with chlorhex to insert the catheter. Due to us using mannequins, we will be using PDI gel today, an apron, plastic bag for rubbish, a 10 ml ampule of water for injection, along with a 10 ml syringe, pair of sterile gloves in your size, and also the drainage bag that needs to be attached to the catheter once it's put in. So I'm now ready to set up for my catheter insertion. So I've got my rubbish bag on my trolley, I've put my apron on, and I've also cleaned the trolley down with antibacterial wipes. So to set up, I first open my catheter pack. Which is extremely similar, or basically the same, as opening out your dressing pack. Finding that first corner and opening that out. Always opening away from yourself first so that there's no chance of contaminating. Now in your catheter pack you actually have 2 trays inside one another. So on that last corner it's a good idea just to take the top one off. This is a little bit big for our trolley and I would aim for a larger trolley to set up on. Just pull these down underneath so that they're not in the way. Now I'll open up the rest of my equipment, so the chlorhexidine, and I've checked the expiry date on those, making sure that that's just going onto the cotton wool balls either end. My 10 ml syringe, my gel, which normally would be just the syringe being opened, however because I'm using the little KY gel or PDI gel, I'm just going to squirt that onto my field, and one of those will be enough for today. My sterile gloves, and the tricky bit is getting the catheter to go straight onto the tray. I always open it out nice and flat, just supporting it at the top, and then hopefully that way it will just drop nicely onto your field. And then our 10 ml vial of water you can either give to somebody if they're helping you. I, on the other hand, just tuck it underneath, just at the front of the field there. So now that I'm all set up, I actually need to go and wash my hands, and just before I do that I'll actually prepare my patient. So pulling back the sheets, making sure that the top part of your patient is being kept nice and warm, and also maybe even over the feet and lower legs is required. For the female patient you would like their knees to be bent up and their legs just flopping out to the sides basically. If need be, you might need to do a little peri-wash just to make sure that the area is nice and clean so that we don't look at further infection or putting bacteria into the system. From here, I'll now go and wash my hands and then come back and put in the catheter.
2, 1.
So now that I'm gloved, I need to prep all my equipment. So the first thing is my 10 ml syringe with my water. And because that's under my field and it's not sterile, what I'm going to do is very carefully, just holding it gently through the field, is pull that back and then take that off. If you have someone helping you, they can push that onto the end of the syringe and then take that off for you. And I will just make sure that I've only got 10 ml because there is quite a bit more in there than the 10 ml because we need to have the right amount for the balloon of our catheter. Now I'll actually get rid of a couple of these items. I don't need the gloves because we've used other gloves instead. We've got our drape and I'll just pop that to the side, and I've also got all my cleaning equipment. So the first thing that I'm going to do is I actually take this completely off the catheter, mainly because I just can't coordinate pulling one off and putting the other on. And for our females, just a small amount of gel on the tip, and then this will then sit into here. I'm just going to take those out. Squeeze a lot of the fluid. We don't want a lot of fluid going all over our patient. So I'm just going to prep everything really, really fast. Because I'm also aware that my patient is currently exposed. Whilst the curtains are around them, it is still exposing our patient and their privacy. So once I'm all ready to go, the first thing that I do want to just very quickly do, and in some facilities this may not happen, you will need to check, is check the balloon. So pushing the syringe into the end and just blowing the balloon up to make sure that there's no leaks, it is actually working, and then I'll just let that down. I'm not going to force it, I'm just going to let that do it itself. That way we don't cause any wrinkles or any issues with the end where the balloon is, and potential pain for the patient later on. Now I need to drape my patient. So very carefully opening the drape with the longer side down between their legs and the white side in this particular one up. So once our patient's draped, the first thing that I need to do is clean the peri area. Now for a female patient, I actually use 2 fingers to help pull back the labia, and I actually put some gauze around those 2 fingers just so that it's easier to hold the labia back. On our mannequin you can see that it's nice and clear as to the anatomy of our patient. However, this is not always the case for all your patients. And I can do this as many times as I need to until I'm happy that the patient is clean and I can go forward and do the catheter. So I'll just move that out of the way, and I'll now bring over the little tray with my catheter inside. The end of the catheter I'll leave in the tray so that as urine starts to pass through, I can catch that in the tray and it doesn't go all over the bed in our patient. You'll notice my left hand is now dirty, and that won't go anywhere near any of the equipment now. So from here, just getting the patient to relax, take some deep breaths, and going straight into the urethra and just pushing forward. Now go forward until either urine starts to drip through, and if that's the case, I always push in another 2 twists. And once we're at that point and you've got urine running, just support the end of the catheter while you blow up the balloon, just so that it doesn't accidentally slip out. Very gently, blow up the balloon, And if the patient feels any pain, just stop and let the balloon go back down, and you might need to push the catheter in a little bit further. And then our last part is just connecting the drainage bag. Once you've done that, remove all your equipment and just tear the drape down and under. And depending on the equipment that your hospital uses, you may have a tape to then just tape the catheter or the bag into place so that it doesn't pull when the patient moves. And I'll just pull that forward a little bit so that the balloon's at the neck of the bladder. Okay, so the setup procedure and also my setup once I've got my gloves on is completely the same for a male as it is for a female. So from here, we still need to do the same. So the first step that I will do is clean my patient. So using the 3 fingers of my left hand or right, whichever you feel more comfortable with, I'm supporting the shaft and I'm using my thumb and first finger to draw back the foreskin. Then using our wipes, starting at the center and circular motion all the way from the top to the base. And again, you can do this as many times as you feel you need to, that you're happy that it's clean enough that no bacteria will be put into the urethra. Now from here, you'll remember that I said we have a 10 ml Chlorhex and lignocaine syringe. So if this was that, I would actually put the tip of that syringe down into the urethra for the male and squirt in about 5 mils of that and just give that about 30 seconds. Just getting your patient to relax just to decrease the discomfort that they will feel. Once that's taken effect, I'll bring my catheter over. I've got my water in my syringe. This will have also still have some lubricant on the end, and just supporting the shaft and drawing back using that same method of just a simple twist as you move forward. With the boys though, because of the length of their urethra, you'll actually need to go the whole length pretty much of the catheter before you might see urine. Try and get it to drip over the container. Holding this, we'll do our balloon. And again, if there's any pressure, nice and slow. If they complain of any pressure, stop, let the balloon down, and you may need to push that in a little bit further if you're not right to the top. Taking that off, take the cap off your bag and connect, and then just slowly draw the catheter forward until it stops, and then we'll remove all of our equipment. And this would also get put into our tape to support so that it doesn't pull. So now it's time to take out the catheter. So there's a few things that you need to make sure that you're aware of. One, that you have a written order to remove the catheter from the doctors. 2, that your patient is aware that this procedure is going to take place and that they have a good understanding of how that's going to be done and when. The equipment that you need is quite simple. Bluey for underneath the bottom, a 10 ml syringe, a kidney dish or tray of some description, and just a pair of gloves in your size from the non-sterile box. It is a good idea to empty the bag beforehand, particularly if it's quite full of any urine, just so that there's not a lot of pressure pulling on the catheter as you're trying to remove it. So once we have our patient's permission, I'll actually check the area, just make sure there's no reddening, no signs of infection, or any areas that might need to be cleaned before we take it out as well, again to decrease any bacteria being potentially added to or entered into the urethra. So once I've done that, I'll put on my gloves. Just grab the tray and bring that down in front, just like we did when we put the catheter in. just so that I can put the catheter into that so that it doesn't go everywhere if there's some urine in it. And I'll just grab my 10 ml syringe. Just gently untape it from the tape and leaving the two together, put the syringe onto the end. Once that's disconnected or all come out, remove that, and now just very gently draw back the catheter into your hand. And we want to do that because if we don't pull it all out in one long motion, it may flicking urine at your patient and at yourself as you come through. If you need the tray, you can use that. Otherwise, I would ask my patient just to lift their bottom and I'll take the bluey with that. But for now, we'll just take the tray over. And now I can send my patient off to the shower or give them a bath in bed, depending on what they require, removing the bluey and any soiled linen or pyjamas. Once I've assessed and cleaned up my patient, I also need to have a look at the catheter and make sure that the catheter itself is in good condition and it doesn't look like there's any parts or disintegration of the actual tubing that's been in the urethra. This one looks all fine, so I'm happy to take that away and we'll get our patient sorted. So once we've finished with our patient, it's important to take a moment to look at how you went putting in your catheter for your patient or removing that catheter for your patient, and looking at what worked well, how you did, what your communication with your patient was like, and areas that you might need to improve on for future catheterizations.